Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and this is the Truth Behind Dentistry podcast. And today I am joined by Andrea Edelen, who has been in the dental field for more than 20 years, beginning in private practice and later becoming a director of dental hygiene and clinical support with Mortenson Dental Partners. Andrea has a passion for patient care, team building, and mentoring, and she supports operational initiatives. So welcome to the podcast, Andrea.
Thank you. I'm happy to be here.
Yes, well, we were pivoting with last minute changes, and we'll just leave it at that for the moment. I'm so glad that you're here and looking forward to an interesting conversation. I love talking with hygienists. I love so much about how much in the world of hygiene people reinvent, find next stage of career pathways. And I think you're one of those people who just kind of organically moved from your hygiene experience into a bigger, broader role in what you're doing. And as we were talking before we hit record, that you're pretty excited about where you are and what you've been able to contribute. So I think that's really good. We could start with you telling me kind of at the point of you'd been in practice as a registered dental hygienist, and then what was that transition like as you maybe this role became available? How did you find your way, or how did this way find you maybe to move into where you are now?
Yeah, I love this conversation because unlike some hygienists, I never made the decision to say I'm leaving clinical dental hygiene or that I'm pursuing an exit out of clinical dental hygiene. I am a clinician at heart, and I think I will be forever. Practice, as you mentioned, full-time clinically for over a decade in private practice before I joined Mortenson Dental Partners, which is a pretty large size DSO. And I joined Mortenson Dental Partners as a full-time practicing hygienist.
Mm.
So I loved everything about the company, the mission and values of the company, supported or aligned really with my own personal mission and values. And I loved the focus on patient care. That was top of mind for me. Where we were at that point, we were looking to grow as a company. We were doing a lot of great things, and we wanted to expand that and deliver more care, and give the opportunity to be a provider to more dentists and hygienists. So I really started in the clinical space mentoring new hygienists that we were bringing on because we were growing pretty fast. And this is one thing about, DSOs that you hear some things about, but we did have different expectations than some of the hygienists we were hiring were used to. We have, minimum standards that are top of mind clinically that really are non-negotiables. And these aren't any crazy things. These are things we learn to do in school that sometimes just fall off the radar when you get into practice. Something as basic as taking blood pressure. So I started really working with new hygienists, onboarding them, mentoring them. And then from there, I just kept saying yes. Like I said, I didn't say no to clinical care. I just kept saying yes when the opportunities came. So from there, working with a lot of the new hygienists, it's like, well, this practice has a whole new team because we just brought this new practice on, and they're nervous, they're anxious, as they should be, right? There's a lot of change. Go help and support that team. Bring them along, help them with their questions and their struggles. And then from there, I joined the operations team. And I love working in dental operations because I'm very passionate about the business side. As a clinician, not all clinicians are, and that's okay. It's really fine. And we don't expect that of all clinicians, but I happen to be really interested in the business side of dentistry. And so there's a whole world out there for me to, learn and grow in, if that makes sense. And I really had to look at it a little differently. Instead of my hands in the mouth and supporting patient care that way, I'm supporting patient care in a different way, if that makes sense.
Yeah, that's great. I love that because it fits with something that I'll often say to people in leadership, especially sometimes to the business owner, but in any role, really, I think it holds true is what should you be doing? that ideally you're doing a combination of where your greatest strengths position you, what you are most passionate about, and then the intersection of those things with what the larger organization most needs you to do. So to me, your story there just kind of captures that. You were just following your passion for hygiene and for patient care interests and to do the highest level work. Obviously, that was noticed. You invested your time, right? So strengths were noticed. Your passion carried you forward. And then the organization said, we need Andrea to keep being a part of these next elements as things grew. So to me, that fits perfectly. I love it. Yeah. So what are some of the biggest changes that you've witnessed in dentistry during your time, and maybe how do you feel like they've impacted uh, hygiene in the way it's delivered?
Dentistry is an amazing industry. So, as you mentioned, I've been in dentistry for over 20 years. And I mean, at the most basic level, we even take x-rays differently than we did then, right? And so, I mean, at the most basic level, but if you would have told me, 20 plus years ago that we would be using artificial intelligence
Mm-hmm.
to diagnose decay, I don't know that that my brain could have actually really been wrapped around that. But truly, just even some of the hands-on lasers in dentistry, that was a big shift. Decade or so ago. I mean, some of those things are state specific, but specifically for me in Kentucky, over a decade ago, our state board allowed for hygienists to start using lasers and diode lasers. And as a practicing clinician at that time, and you practice for over a decade, and you have a certain amount of tools in the toolbox that you're equipped with to give that great clinical care. And then, wow, we have this amazing new instrument that we can use. So that's one that really stands out to me in my career that felt career changing, if I'm being honest.
Yeah.
Truly being able to, obliterate bacteria in a way that we had never been able to do before, and then fast forward to the last few years. I mean, the artificial intelligence that I mentioned, we're able to rely on that. It's obviously our dentists diagnose, but
Right.
to be able to utilize artificial intelligence to build their confidence and communicate with patients, it's just groundbreaking. And even on the hygiene side, we use artificial intelligence for voice charting now. And with the current landscape, which is another change, is just staffing, the labor shortage that we have, that pull for people to do remote work and work from home. We really have had to pivot in dentistry with the teams that we have. I mean, there's a hygiene shortage across the companies. Utilizing technology like AI
Mm-hmm.
and other instruments to be as efficient as possible to deliver patient care has really changed dentistry in a great way.
Yeah. Yeah. 20 years. Yeah. A lot has changed. Yeah. Artificial what would have been like back in 2004.
Yeah, yeah, yeah.
What are we
Uh-huh.
talking about here? So technology has made things more efficient in many ways. It's made the work easier in some ways, right? It's allowed for maybe more effective evaluation. I think the ability to see certain things that maybe were harder to see in the past, right?
Well, yeah, I mean, another example to your point is now dental practices use cone beam technology. That's a game changer, right? I mean, when you're looking at trying to, diagnose, look at a tooth and really determine what's wrong. If you look at a flat X-ray, which X-rays are wonderful, we need those, but when you compare an X-ray to cone beam technology, it's a lot more advanced.
Yeah.
You can see canals that you would miss on an X-ray. So, we are able to see things sooner. And as you know, I mean, anything that we can diagnose and treat sooner is going to be less invasive.
Right. Yeah. And then to your point also about greater ease of communication, I think that the ability to have better technology, to see things more, allows for more to be shown, to paint for patients their project their future ahead with or without certain care, taking action on certain care recommendations. Because the communication piece, the education piece, I feel like years back, especially, was a bigger challenge for doctors who are not always most trained in communication anyway.
Mm-hmm.
That's
Mm-hmm.
not primary skill set that's trained in school. So I think everything that's
Yeah.
assisted that has made that really, really beneficial. But I think also one of the things, and I'm not sure how much you're seeing this within in your company, is also shift in perspective about as far as products and the oral health effects on systemic health and things like that. I'm not sure how much you're engaged in that, but I mean, all of those things that were not really talked about so much 20 years ago.
I'm extremely engaged in that. And I couldn't agree more with what you just said about the communication piece. Patients have different expectations now, um, and they should. And the days of just, this is what I see and this is what we're going to do, that's changed a little bit. Patients have access to more information.
Yeah.
They have more questions. And that's a wonderful thing. I think that's a great thing. And the oral systemic link, for years and years, that felt like a disconnect in medicine and dentistry, and how how the health is connected to the overall health. I'm extremely in tune to that. Our company's in tune to that. And we have several initiatives involved in the oral systemic link right now, because the information's there and you can't ignore it anymore. I mean, the body and the mouth are linked, and there is more and more evidence proving that out every single day.
Yeah, it's hard to keep living with a flat world concept when you see more and more evidence that that's indeed not true. And sometimes it's people are busy. It's sometimes keeping up is hard. Sometimes being willing to risk change is hard. So, but I think the collective community keeps moving forward, and that I think helps carry people forward if they're willing to go, right? So another thing that you love to do is you love helping new grads. So there's an inspiration there for you that you've expressed. Maybe tell us a little bit more about what drives that passion and what's that experience like for you, for them?
Yes, I love working with new grads. And I'll be honest, it stems from probably my own experience as a new grad. The access to information, the access to people, it just wasn't there. Years ago, you had your network from, your circle, maybe your classmates, people you met in school. And then, you go to this dental practice and you feel like you're expected to know everything. And there's no way that you can know everything. You can't be a new grad and be experienced at the same time, right?
Right.
So, and I'm not sure that you've heard this. You probably have, because I know you talk to a lot of dental people, but dentistry can feel isolating, especially as a new grad. You've got all this anticipation, getting through school, taking the boards, getting your license. And then it's like, now I really have to do this. I have to be on stage and show up as a confident clinician, and you need support to do that. And I didn't necessarily have that support. We at Mortonson Dental Partners feel extremely passionate about new grads, and we have always, but truly the hygiene shortage has really forced, not just us, it's forced us in dentistry to look at new grads and say, are we supporting them in the way that we should? Our new grads right now, all hygienists really, but our new grads have more options than they've ever had.
Yes.
The days of throw them in, see if they sink or see if they swim, those days are over. We can't do that. And we don't want to do that. And so we have implemented several programs, from like side by side mentoring, in their dental practice, to networking, special sessions, all types of things to really support our new grads, because they need support and they deserve support. And if you can build their confidence early, they're more likely to, stay with your company. It supports the retention of your team members, but enjoy their career. And ultimately, life is short, and you want to enjoy the thing that you're doing 30 to 40 hours a week.
Yeah. Well, it kind of begs that question of why people stay wherever they are doing whatever they're doing, right? And the research pretty much shows it's not the extra dollar or two or even five potentially more an hour that they might get. There's all sorts of other ancillary factors there that lead to greater fulfillment. And I think, and having friends, having people who care about them and where they do feel supported is a huge thing. People leave a lot of times, just like patients leave because they don't feel, or any business, because they don't feel important. They don't feel valued. So I think that applies to team members certainly as much as it does to patients. And anytime I hear that level of investment in team members, it makes my heart happy, because I feel like too much of the time the focus can be, in many businesses, many practices, focusing on the patient and stepping over the team and the support and development for the team. So I think that's great.
You can't serve the patient if you don't have the team. I mean, you can't do that. And our patients are extremely important. We can't run our business without patients. It's really hard to deliver a great patient experience if you don't have an engaged, satisfied team. And ultimately, people want to contribute, and they want to feel that they're contributing, and they want to be recognized for their contributions.
I think we all like to be seen and recognized for value that we deliver, right? And I don't know that there's ever too much of that for most people. So, and I think the mentoring piece is great, because we're talking for new grads, not just the technical skills they have to now be practicing with quote unquote real patients, right? Speed. And there's a lot of new situations that they're facing, right? But also just the ability to practice communication skills
Yes.
that maybe hadn't been honed fully previous to that, or how to, now they're new in an office with a bunch of strangers, right? So how do you make that easier for people? So I think that's wonderful that you're doing that. What sort of other resources do you feel like are helpful for new grads? Is there anything else you'd want to share in terms of preparation for their peak success?
Well, I'll be honest. I think for new grads coming in to a situation where they don't have to be with hands-on with patients from day one. To your point, in the dental hygiene program and all of the things that program has to get you from point A to point Z, where you're taking your boards and you're receiving your license, they can't train you on all of the patient interactions and all the communications that you have, and the different personality styles. When you are involved in healthcare, every walk of life, and so we will typically bring our new grads in to shadow for anywhere from a week, 2 weeks, sometimes even longer. We work very closely with a lot of dental hygiene programs, so we're fortunate that we get some of our new grads before they've graduated, which is wonderful. I love the dental hygiene programs that do that, because that real world experience is really critical before they go into the real world. So we have our new grads shadowing seasoned hygienists that have been, working with patients for anywhere from, a year to, 30 years. And they're actually witnessing, those patient interactions, those things that are going to build their confidence. Oh, when a patient asks this, I didn't encounter this in school. How would I handle that? How should I handle that?
Yeah.
And to see that. And, sometimes when you're shadowing someone, that doesn't mean that you would have handled it that way, right? That also gives you the opportunity to say, that's interesting. I think I probably would have handled that differently, or I might have said this.
Right.
And I think that that's really invaluable for new grads.
Yeah. I mean, ultimately, you're going to make it your own. You are still you delivering a service, but you don't have all those data points of experience. You don't have all the variety of people like you're talking about who have different needs, for communication, for understanding, for security, comfort in the experience, right? And what's going to work for some people is not going to work so well for others. So I think that's wonderful, and definitely a benefit, right, of being a part of a larger organization like that is valuing mentoring compared to having your first experience be in a small practice environment where maybe there was nobody who had any time really to even help you at all, really. You're kind of thrown in and get started, and hopefully you can figure it out, right?
Yeah, and I do love I mean, because that's still going to happen to some new grads, because sometimes that's just the nature of the practices and the state of dentistry right now. A new grad might be going into a practice with no other hygienist, and that is extremely tough. And I know that it does happen with a lot of new grads. And now, though, I think the ability to connect with people at different levels, whether it's social media, Discord platforms like that. Social media, it's one of those things people say it's, you take the good with the bad, but that access to connect with people is extremely valuable. So I would say, at least for new grads now that might find themselves feeling like I'm on this island all by myself, there are ways to connect that we didn't have in the past.
Yeah, that's great. We've got a couple minutes left. We had been speaking before I hit record here about Mortenson Dental Partners, and you don't just work there, you're a fan of Mortenson Dental Partners. So maybe you can take a couple of minutes and just say why. What is it about this organization that gives you that smile when I even ask you the question?
I really appreciate the opportunity. I really am a fan of Mortenson Dental Partners. Like I said, I started there 16 years as a full-time practicing clinical hygienist, with no intentions of doing anything different. Just let me serve my patients and serve patients very well. And I had the opportunity to do that for Mortenson Dental Partners for a long time. But all DSOs are not created equal. We all have our strengths and our great qualities, but just the story of how Mortenson Dental Partners was started by our founder, Dr. Wayne Mortenson, is so special to me. And his legacy, he has stepped down. We let him retire. We didn't want to, but we did let Dr. Wayne retire. But his legacy is still so present. So he and his wife and his family of 4 children moved across the country in the 70s to Louisville, Kentucky, to go to University of Louisville Dental School. And they worked their way through him, going to dental school, graduating, basically built the practice themselves. I mean, they had a church pew in the waiting room, right, in the welcome area for patients to sit on. And he practiced and built a wonderful practice. And then as his children started graduating dental school, he wanted to support them and started kind of expanding there to give them a little bit of an easier path than I think that he had. And then he really started partnering with like-minded dentists. And that's how we started to grow. And so we partnered with other kind of like Dr. Wayne's in other areas, if that made sense. And we expanded, and we have maintained his legacy. We have maintained clinical autonomy for our clinicians, which is extremely important. Our mission and values are present in every decision that we make, every single thing that we do. And as we continue to grow, does that get a little harder? You do have to be more intentional, right? But I still feel like with over 140 practices, we still have that kind of private practice or solo practitioner feel, but we have all the benefits of a large organization. And we also are employee owned. So we have an ESOP, which is a huge benefit of Mortenson Dental Partners. So all of us that are employed by Mortenson Dental Partners are involved in the ESOP. And so we have shares in the company, and we get that just for working there. So one of Dr. Wayne's, just parts of Dr. Wayne was giving back and doing good. And we're still very focused on that.
That's wonderful. I mean, I love enthusiasm. I think that it's rare, seems rare to have people who are really fans, like I was saying, really enthusiastic about where they work and who they work for and with. And so I know your smile and enthusiasm is genuine about that. If you didn't feel that way, you probably wouldn't be on talking with me in the first place. But I really do appreciate you, bringing that to this conversation and hopefully modeling for people who may be struggling at any point, no matter what their role is, to be able to see that more is possible, different is possible, but to be able to find that place of passionate contribution. And I always feel like life is too short and too long to not locate that and live there. And the older I get, that seems more plainly apparent to me. So thank you for your time today. I really appreciate you coming
Thank you
on,
very much.
sharing.
I'm happy to be here. Yeah, thanks.
Yeah, absolutely. So for everybody, thank you for your time. Thank you for tuning in. I've been with Andrea Edelen from Mortensen Dental Partners. This is the Truth Behind Dentistry podcast. Please subscribe. If you haven't done so, please share this with friends, whether that's other doctors, hygienists, or whomever you think that might want to know a little bit more about the truth behind dentistry. So we look forward to seeing you next time. Thank you.